December 2, the Upper House approved the legislation for future pandemics, including new rules that make hospitals to follow government orders. The legislation was approved by a majority vote of both ruling and opposition parties. During the pandemic of COVID-19, there was a conflict occurred between the government and the hospital business in Japan. During the pandemic, many hospitals refused to make beds for COVID patients. Unlike other countries, Japan didn't have a way to execute an executive order for hospitals to cooperate for COVID-19. What government could do was to beg the hospitals to cooperate, yet many refused. Thus, although there were enough doctors per capita in Japan, there was a shortage for beds for COVID patients. The legislation will enable all hospitals to be obligated to make agreements with local government, and big hospitals are required to provide medical services. First, local government assess how many beds are needed locally. Based on the plans, agreements will be made prior to outbreaks. The legislation also allows the government to reconsider the classification of disease under the infectious disease law. The infectious disease law classifies infectious diseases in 5-tier category based on severity and infectiousness. Currently COVID-19 is in the second highest tier, and the Ministry of Health is considering to lower the tier. The legislation will take effect from April 2024.